All right, Peter, welcome back to BS Free MD. It is always great to talk to you. I still I still get kind of my mind is blown every time I think about how much all of our lives, especially those of us who think we're in the medical freedom business, have changed in the last 5 years. Can you possibly imagine that yourself, a researcher, or a cardiologist, a member of universities and so forth, would have ever written the defining paper on the cause of autism being vaccines? Can you imagine that even 10 years ago?
Yeah, I couldn't possibly imagine. It's so great to be back on BS Free. Dr. Peter McCullough here in Dallas, Texas. Now, I'm an adult internal medicine and cardiology doctor. I just finished with patients. We were talking about it off air. So, we're all clinically engaged. And like so many doctors you see on TV, a lot of those doctors haven't seen a patient in many, many years. And so they lose touch quickly on what is a reality. But, just the other day, I had a former academic colleague email me. Literally, my academic friends just disappeared overnight through the pandemic. It's been 6 years I haven't heard from this guy. He emails me, and it's regarding some detail of a sponsor we worked with over in India. And I responded. I said, I've been so busy with all the vaccine injuries in my clinic and spike protein myocarditis and blood clots and on and on. And this doctor who I knew took the shots and I knew was at a university that it did nothing for COVID patients or long COVID patients, guess what his response was? Nothing. Zero. So that's what we're seeing right now. Patients are so frustrated. They have vaccine blood clots, or they just have complications after having the illness, just after the illness, no shots. And there's no recognition out there by the practicing community. It's as if the infection is not playing a role in anything, yet we see a building literature that the illness is greatly related to chronic long-term problems as well as the vaccine.
Well, May and I discussed in our last BS Free MD episode, I named long COVID the great unmasker, because I think that there's a lot of people that have chronic problems. They may be on several different medications. They've got a lot of their chronic diseases kind of sort of managed. And then all of a sudden, 3 years ago or 2 years ago or whenever, everything just got way worse. And they just assume it's, well, my neurocognitive decline just got worse, I'm getting older, or my brain fog came back, or now, I had a blood clot, but I think my great aunt Martha had a blood clot too, so maybe it's just genetics. When really, if you take the time to look, it's actually long COVID. It's the spikeopathy that's unmasking what's already been there. Are you seeing the same thing that we are?
So true. We rely on the antibodies to the spike protein, quantitatively measured by the Roche Alexis system. It's offered through LabCorp. Ranges from 0.8 to over 25,000. And it has a correlation with spike exposure at about 0.8, 0.9. So this is a very useful test. You can get it without a doctor's order at LabCorp. So if you go to LabCorp, Labs on Demand, COVID antibody test, click it, pay $69, get your blood test. So everyone's doing that. I had a patient today, he's a doctor, had a lot of exposure to COVID patients, never took the shots, had COVID himself, no vaccine. He's developed blood clots in both the transverse and the sagittal venous sinuses in the brain. I mean,
Holy smokes.
Major blood clots. And he has been on a ton of drugs. He had refractory headaches. Thank goodness he hasn't developed hydrocephalus. And today our review is, the conventional blood thinners don't penetrate the brain very much, to be honest with you. They're kind of intravascular. We've got this blood-brain barrier. And the discussion with the neurosurgeons is actually using warfarin, which does have a little better penetration. We're doing spike detoxification with the wellness company, Ultimate Spike Detox. So there's one of my products right here, Ultimate Spike Detox. Now, his spike antibodies are way down. So anything over 5,000 on the spike antibodies, there's probably spike in the bloodstream. That's what our information shows when we measure spike directly with the research lab in Germany. So over 5,000, you got a spike in the bloodstream. Under 1,000, should be no spike in the system whatsoever. He's down considerably. He's now down below 1,000, and we're just left with this residual thrombi. Now listen, this was just long COVID with headaches and some difficulty with memory, and his brain is loaded with blood clots. This is just the infection, guys, not the vaccine.
So I have a couple questions directed to some of the things you said, and I want to get there. But let's back up a little bit if we can, and let's share with our listeners first a little bit about on the mechanisms of what happens with long COVID. Because like you said, a lot of people don't realize, and I'm going to be one of them, and here we are, two doctors living in the same household, and I'm suffering. And I looked at the timeline and pictures and things going back, and I blamed it all on there was a lot of stress in our life. We were working in a COVID clinic. I got COVID really severely. I got one episode really badly, and then I got a second with the COVID toe and vasculitis, and blamed it on my autoimmune stuff. That was in November. Had a hip replacement in January. We moved from our house in March. I had an elbow surgery coming up. So by March, all of a sudden, I had this crazy episode where I was like anxious and my skin broke out crazy, and I felt like I was under a lot of stress. And that was the beginning of the downfall, which I blamed on I'm in menopause and my hormones aren't balanced right. Because, the big thing now in women is HRT and getting. So they kept upping my estrogen, which is a mast cell liberator and can make things worse, which I talked about before. But for 2 years, I literally played around with hormones up and down with people saying it was all hormone stuff, never thinking, and here we are in the business like a long COVID, we're working in COVID clinics around people with it. We've been right from the get-go, swabbing, testing in the hazmat suits, in the thick of it, giving immune globulin, whatever. So it took me really until early this year when weird things were happening with my body, like not sleeping, waking up with my heart rate of 120 in a panic, and then someone testing my spike protein level through Quest, mind you, which was topped out at 5,000 or 2,500, I think, yeah. But,
were you unmeasurably high over 2,500?
It just said greater than 2,500.
Yeah. Well, then you went,
that was in June.
Because May spoke to you, and
that was
you
in
said,
June, and then I started having all these weird GI problems with uncontrolled diarrhea brought on by histamine foods, intolerant to a lot of histamine foods, mast cell activation stuff. And then I had another quantitative Quest test again that was still over 2,500. And then there was a lot going on this year, and I'm thinking, maybe this is all COVID. And then I saw your publication about measuring spike protein, just like you said, testing at LabCorp, which I did the test. And then I texted you and said, hey, Peter, what do you think? And you said, go to LabCorp. My level was it's 12,000 at LabCorp.
Oh, my Lord. So, yeah, the average for somebody who took the shots is 11,000. Paper by Barham and colleagues. Somebody with long COVID just from the virus is just under 2,000. So this is what happened to you.
We did get the shots. So can you go? So that's my quick story about
But you had a lot of this. May, you had a lot of this. You had the virus. Remember the virus, you get the tip of the spike protein in your body. I didn't take the shots, but I got to the point, mine was 2,300. My ears are ringing. I didn't feel well. It was just this. Now, let me say, in a case like you, now you took the shots and you got COVID, right?
Yeah, we had the first Pfizer series, the first two.
First two Pfizers. And
very first, and which Satchel Adapova seems to think was probably a saline or a dud. I don't know.
Yeah, we got no immune response at all, like no sore arm, nothing.
Here's the thing. In my experience, in people like you, or your case specifically, when you have these symptoms that start to build, particularly GI symptoms, and let me ask you another question. At night, were you having night sweats? Were the sheets wet when you woke up in these?
it's not like menopausal. It's more like a hot sweat. It's like heat. So
Okay, it's a heat sweat.
And I've read with histamine, it's more like a dry sweat. It's a little bit of.
Well, here's my observation.
But it's not like the true menopausal hot sweats. This is like I'm hot, I'm dry, I'm anxious. I've got restless leg syndrome. I'm panicking, and it lasts till about 11 in the morning.
But here's my observation, though, that if there's GI symptoms in particular, night sweats, evanescent types of rashes that aren't steroid responsive, any type of craniofacial syndromes, normally sleep disturbance, there is what I consider a SARS-CoV-2 reservoir. And it's based on a publication in the GI pediatric literature and then the NIH autopsy study done by Chertow. And both of those studies show that the virus itself, the whole virus, can be in your body and be slowly replicating. And I think that's what was happening. And in that slow replication, the virus is everywhere. In the Chertow study, it was in the skin, the eyes, the liver, all the organs, the virus itself, the virus. And the vaccine just makes it worse because the messenger RNA is cranking more and more spike protein. But when I have a syndrome like this, not only do we recommend spike detox, which is great to get rid of the spike protein, but it's my experience that patients need full dose ivermectin. So I recommend when we think there's a reservoir, I put them on full dose ivermectin. So someone your size would probably be 36 milligrams a day for 90 days.
So before I want to
that's
talk.
Really interesting.
Interesting. I want to get into that a little bit more because I have some different thoughts about your product and then the ivermectin. But with the long COVID itself, we know. I mean, like you said, the spike protein can be anywhere. But there's typically in long COVID, I'm seeing kind of two main I call pathways. There seems to be more that cardiorespiratory types of people that have the post-exertional malaise, like the no energy, brain fog, but lack of ability to perform, like walk down the block. Their cardiac functions poor. They have low oxygen saturation. They basically are getting more clotting, this type of a thing. And then there's a pathway that seems to be less talked about, but I'm hearing a lot about more in podcasts and people, especially in the nutrition world, that deal with it's the histamine autoimmune thing, where there's like more of a brain gut issue with mast cell activation syndrome, especially linked with people that have a history of Ehlers-Danlos or connective tissue disorder. And then the neuro issue, which is responsible for mood, but sleep and histamine in the brain, regulating that sleep wakefulness, adrenaline type stuff. And so it seems to be kind of separate into those two categories. And in some of the groups I've been in and people I've connected with, it seems there's that separation where these people have the two types.
Well,
have you
each
heard of that
person, remember when you get the virus, which 97% of us have, this virus has a human-engineered spike protein on it. And it's got 1,200 amino acids, about a dozen glycosylated side chains. I think it's about 3,400 base pairs coding, but it's an artificial protein. And the human body can't get rid of it itself. It doesn't respond to standard proteases in the human body. It's resistant to human proteases. So the only things we know that break down the spike protein are nattokinase and bromelain, which are in spike detox, maybe sereptase, which is not, it's a separate enzyme, maybe lumbrokinase, potentially papain, but for sure the two that are in here. That's the reason why the spike detox is essential. But because the spike protein, it depends on the depth of infection and how many infections you've had. Of course, you've taken the vaccine, now you're super loaded with it. It all depends on how the body is reacting to it. So would a foreign protein destabilize mast cells and basophils and release histamine? For sure. Would a spike protein that attaches to red blood cells cause micro blood clots? For sure. The spike proteins found in blood clots. Like my poor patient who just had the infection has got blood clots in his brain. Now, that's horrifying to think that can happen. But for sure it can. Can it cause heart palpitations? For sure. The spike protein is in the heart, particularly in those in the vaccinated. It's been shown in a paper by Bowmeyer. Does it get into the nerves? For sure. Post-exertional malaise. It was a good study demonstrating that in people with long COVID, they do a biopsy of the calf and find basically red blood cells stacking up. And when they analyzed the mitochondria of the skeletal myocytes, they were markedly dysfunctional. So the answer is all of the above.
Right.
The key thing to understand, though, is the spike protein. So when all these research studies say, well, we're going to try this or that, or here's an inflammatory factor, it's like, yes, every single inflammatory factor is elevated because of the spike protein. It's not the inflammatory factor, it's the spike protein. It's not histamine release, it's the spike protein. So what the problem is people are doing is they're chasing secondary things as opposed and missing the fact. So there's many, many papers written on long COVID. They've never even measured the spike protein. They've never measured antibodies to the spike protein. They don't even mention spike protein in the paper. So in the Biden administration long COVID research program, they spent $1 billion on long COVID. 0 new understandings, 0 protocols, 0 new treatments, because they never considered the cause of long COVID syndrome, the spike protein. That's the reason why this is so critical.
So the spike protein, we know, binds to the ACE2 receptors on cells, correct? And
well, just hold on right there. If it's the natural virus, yes. So you have the S1 segment is sacrificed, the S2 segment, closer segment, is sacrificed at the ACE2 receptor, and then the S1 gets in the body. The vaccine's a different story. The vaccine, Pfizer, Moderna, make the full-length spike protein, and they have a proline insert in it, and it does not bind to the ACE inhibitor, the ACE receptor at all. It's actually pre-fusion conformation. So this is important. The ACE receptor is one of the reasons why you can get rid of some of the spike protein immediately with the infection, because there's called receptor-mediated catabolism.
Okay.
It's a very important point. So if you've done well with COVID, you never took the shots, and you had just a brush with COVID, and your antibodies are less than 1,000, you pretty much had receptor-mediated disposal of the spike. You don't have any spike in you. You just have a little flush of antibodies. But if you're taking the shots and you've had COVID a bunch of times and you've got antibody levels of 12,000, I think you probably have full-length vaccine spike in you, and you probably have the tips of the spike protein in you from the infection.
All right, so if there's other people out there like me in this situation, and I'm sure that's the majority of people, because I don't say the majority, but so many people have had a couple vaccines, got infected too, and they're suffering through this, and a lot of the treatments.
Well,
there's
hang
so
on.
many.
Before we get into treatments, can we just mention a few other diagnostics? When the body is loaded with spike protein like this, it's my experience, managing thousands of patients, that if they go get tested for Lyme disease and tick-borne illnesses, universally positive antibodies. Universally. I've never seen one negative. If they go get tested for mycotoxins and mold toxins, uniformly positive. Never seen a negative one. And here's one that's very interesting. If they get tested for heavy metals, uniformly positive across multiple heavy metals. I've never seen a negative one. Never seen a negative one. So what happens to these patients is they travel around and they'll go to a clinic and they'll say, well, you probably have Lyme. And I said, well, they check the antibodies. And I had a patient like that yesterday. She was a naturopathic doctor herself. So she had all these things. I said, let me close my eyes and let me just guess. Your heavy metals are positive. You're positive for all tick-borne diseases, and you're positive for all mycopositive. She goes, well, how'd you know? I said, because you're loaded with the spike protein. That's the reason why. And so it has been mentioned.
That's a good point. That's a good point, because people are going on Instagram, social media, and seeing all these alternative people say, well, check for this first. You need a parasite cleanse. Check for Lyme. Check for mold. It's going to be positive. Do that first. When what you're saying is it's going to be positive in everybody because...
Right. It's positive in everybody because spike protein is so dysregulatory. So it's very important. The spike protein in one of the side chains has what's called a glycoprotein repeat, a glycoprotein 120 repeat. It's the identical sequence to a sequence in HIV.
Right.
Identical.
Okay.
And so when the Australians made a vaccine, they exposed this part of the spike protein. It turned everybody HIV positive in the trial. They didn't have HIV, but their HIV test was positive for being a subject in a COVID vaccine trial.
Wow.
Okay. So what I'm telling you is whether you've had the infection or the vaccine, it's immunosuppressive. It's immunosuppressive. So because we uniformly get tick bites, I've never seen somebody negative, by the way, for a tick-borne disease panel. You know, you'll see positive across the board, babesiosis, Lyme disease, uniform. Except another one, Epstein-Barr, universally positive. So, and you'll see tons of early antigen positive. It's because the body is immunosuppressed, and you can't possibly deal with these foreign antigens that stay in the body. And in this case, it's the whole virus, the Epstein-Barr virus. The same thing with heavy metals. For some reason, heavy metal detoxification is disturbed because of the spike protein. Now, did that patient really have a Lyme problem, an EBV problem, a mold problem, and a heavy metal problem? They have 4 problems that were just minding their own business? Or was it because they took the vaccine and they had COVID? I tell you, I think it's due to the spike protein. And one thing I've observed, patients do not get better until the spike protein goes down. That's universally true. They will not get better. They can treat Lyme morning, noon, and night, heavy metals, they won't get better.
So your advice would be probably not to even bother testing those until you've dealt with spike protein.
No, I mean, I'll follow, I follow the American College Emergency Room Physician. If somebody has a documented tick bite, they get treated with doxycycline early. I follow the guidelines. That's it. If we had a target rash, I'd treat Lyme like it looked like the target sign when you go shopping. If somebody worked, in a Formula One race car and they got exposed to all this mercury or something, but just an average person like you or me, I wouldn't bother with all these tests. They're all positive. I'm telling you, 100% positive. And no one will feel good at a spike antibody of 11,000. No one. And you won't get better, and you won't really feel better until that spike is at least 20% reduced. You get below 5,000, you start to really feel better, and you get below 1,000, you're done.
So before we get to all the treatment options we think or might be available, is there ever going to be, I know that they're doing it in research, where you're able to measure actual spike antigen.
It's so frustrating. It's the easiest test.
But not commercially.
No, it's an easy test. It's an enzyme-linked immunosorbent assay. It's an ELISA assay. It's very easy to measure. It is not a problem. You may wonder, well, why doesn't anybody offer this?
Right, exactly.
And I have to tell you, in 2021, I was asked to give a lecture in Tulsa, Oklahoma. And I went up there and I gave a lecture, and I met this lab director. And he goes, "Hey, Dr. McCullough, I'm measuring spike in the bloodstream." He goes, "You can't imagine how many people are loaded with this spike protein." I said, "Really?" I said, "With the infection or the vaccine?" He said, "Both. They're loaded with both."
Wow.
I said, "Oh my gosh, this is 2021. I said, "This is fantastic. This is going to be a very useful test for us to figure out what's going on. When is it going to become available?" He says, "Well, a Japanese company has it, and they told me the FDA will never let this on the market. Never.
It's just criminal."
But we do have a new FDA now. It is no longer.
Well, I mean, there may be a couple people at the top, but there's thousands of the deep staters who I'm sure have been told, do not let a spike test get on the market. So what happened
the problem. I was going to say, go ahead.
Well, I mean, what happened is, so Invitrogen announces they've got a spike test, ELISA test. Well, great, we're waiting for it. Never comes. Then there was Albany Labs and all these different labs that are going to have a spike test. Nobody is able to bring it to the market. 97% of us have had COVID. So we've become reliant on the antibodies, and then reliant on a German lab in Modia. So we send samples to Modia, and there's been enough cases now where we know if the Roche Alexis antibodies are over 5,000, they will have spike in the blood. Now, what they find in the blood is interesting. It's not just full-length spike protein, which you get with Pfizer and Moderna, but there's fragments of spike protein. There's also fragments of DNA coding for spike protein, fragments of DNA for SV40, the promoter, the origin of insertion, and the enhancer. There's spikes, there's antibiotic resistance genes, fragments of DNA, and there's fragments of RNA. So it's a very, very dirty vaccine. So you can find RNA and DNA in the bloodstream, find spike and spike fragments in the bloodstream, and when we check, we find it everywhere. So one of my patients, we've sent a series of skin biopsies. It's there. I just got his results back. They say, well, Steve still got spike in his skin. Oh, no wonder people don't feel well. I'm here to tell you guys, we've been poisoned by the virus and the vaccine.
Yeah.
It's poisoned, all right. I mean, it's flipped my life upside down, and I'm just one of like hundreds of thousands of, not millions of people that it's taken my life away.
Yeah.
As a functioning doctor, I'm not functioning. I'm unfunctional at home, and how I feel physically. Some days I'm barely able to get dressed and even make it here. I mean, it's devastating. And so, the issue I'm even having, Tim and I, convincing other even practitioners that are seeing is saying, okay, here's my antibody titer, it's 12,000. Well, maybe you got robust immunity. Is there any way of saying Dr. Peter McCullough's publications correlate well because we don't have the antigen test?
Well, I've published a Substack on this where we looked at every single study that measured spike.
Right.
And measured the antibody. And the correlation is about 0.8 to 0.9. It's really tight. So no, it's not just robust immunity. It really has to do with, like I say, over 5,000 for sure there's going to be spike there. It's just a matter of, is it really bothering you or not?
Right.
And in your case, it's really bothering you. Every so often I'll see somebody who's got 20 or 25,000 and they have zero symptoms, zero.
Should they be worried and be tested then?
Well, yeah, I've tested them. And the thing is, you start asking, are you as good as you were before the pandemic? Can you run? Are your ears ringing a little bit? And invariably, people have something. Like today, I had a guy who did not take the shots, but sure enough, during the pandemic, he developed paroxysmal atrial fibrillation. He just had a litany of problems. I mean, just every day there's something. I was at 2,300. Myself, 2,300. You're at 11,000. At 2,300, my ears are ringing. I didn't feel that well. I couldn't run like I used to. And I had to go on spike detox. Again, it's the only thing we know that reliably gets it down. I went from about 2,300 down to about 900. My tinnitus is about 90% reduced. And I feel great again. Sleep disturbance gone. Everything is gone. It's related to the spike protein. I have enough patients in my practice now. I've done this over and over and over again, and they're better. Even the man today with the blood clots in his brain from having COVID, his antibody levels were up there, and I'm trying to remember what they were. He was over 5,000. He's now down below 1,000. I think he was 910. And he said, the blood clots are still there, the best we can tell by imaging. He says, the good news is the headaches is better, and he gave me a bunch of other parameters where clinically it was better. So things like blood clots can lag behind and may need additional treatment. But the point is, you're not going to feel better until your spike antibodies are down, and that as a proxy for having spike protein out of your body.
Can we talk a little bit about treatments for that? Because, man, there's been a lot out there. I mean, I know you've been really forthcoming with your spike protein detox and the ingredients in there. Mm-hmm. But there's other stuff on the horizon that I have heard other people like Dr. Robin Rose talk about, that they're having good results with some flavonoids, and then things like TANPAS, like ozone and EBU therapies.
Right. So let's kind of
and some other flavonoids, and right. Because your product is great, except with what I'm struggling with the mast cell thing, the nattokinase is just impossible to take because of the histamine that it triggers the release of more histamine, causing more side effect. And so you mentioned lumbrokinase, serrapeptase as an alternative.
Well, a
So
couple
what are your
points.
thoughts?
A couple points. If you're feeling something with the nattokinase, that's a good sign. That means you're actually, dissolving spike protein. That's the reason why the antibodies are going to go down. The spike protein itself is going to go away. So it's a good thing to kind of go through that. People used to think, well, it's soy allergy. Well, it's not, because we changed. It's made from chickpeas now, so it's not a soy allergy problem. But that's a good thing. Now, I mentioned, remember, it's a protein, so that means we need enzymes to get rid of proteins. So nattokinase and bromelain, have really, really solid scientific support. Serraptase, we think would work. Papain, we think would work. Lumbrokinase, we're not sure.
Okay.
Now, outside of that, everything else is secondary. Now, there's one product, and we have a formulation of it. There's one out of Italy for a while, and that's N-acetylcysteine. Okay, N-acetylcysteine. It doesn't necessarily need to be augmented. It may denature the spike protein and allow the liver and the kidneys to clear it. By the way, the spike fragments come out in the urine. Now, everything else, honestly, is just going to be symptomatic measurement. So let's take something like ozone, take some blood out of the body. That's a complete waste of time. You have 5 liters of blood. Even if you take out 250 cc's or 500 and try to hyperozonate it, the spike protein is in the skin, it's in the liver, it's all over. Most of it is you can't even get it out. Like Bruce Patterson at Incel DX has shown, the S1 segment is actually inside white blood cells. So you're not removing any white blood cells with EBU. And all you're doing is, when you pull blood out of the body and you bring it through tubes and put it back, all you're doing is causing more inflammation. Talk about destabilizing mast cells and basophils. I've even had some people with EBU get a blood clot in their arm afterwards, or the effusion site. So no, we don't recommend that. How about stuff like vitamin C and antioxidants? They don't do anything for the spike protein. Try it, that's okay, but it's not going to do anything for the spike. How about pouring vitamins? Same thing. It's not going to get rid of the spike protein. Bruce Patterson.
What about the big push, which is the nicotine patch protocol, which is big everywhere, of course.
Well, that's the thing. If you can't get rid of the spike protein, can you block it a little bit? Well, that's one of the reasons why in spike detox, that's the reason why curcumin. So curcumin, that has human randomized trials. So curcumin clearly blocks the spike protein, clearly. Okay. So curcumin is on base, and in fact, you probably can escalate doses. I think with our product, you get like 1,000 milligrams. You can even take supplemental, go over 2,000. So curcumin, that's on base. Nicotine, there's one study from Switzerland. We have enough experience with that. That does block the spike protein at nicotinic receptors. So I routinely use that in my practice. I mentioned having a SARS-CoV-2 reservoir and viral replication. That's the reason why ivermectin plays a role. It doesn't get rid of the spike protein, but it'll terminate the replication of the virus. I'll give you 2 other methods by which you can probably get rid of spike protein that in my experience, work, and I think the literature supports it. One is sweating, May. Do you sweat much?
Well,
I
used to when I could do things, but yeah,
Well, here's the thing.
Not much now. So
there's a paper.
Just outside, is going to be outside running, walking, working out just as good as sauna, or does it got to be the sauna detox? What are your thoughts?
Sauna gives a large volume of sweating, which is pretty amazing. So 2 papers by Hannah and colleagues show spike protein comes out in sweat. And by the way, so does messenger RNA, because you want to get the vaccine out of you. So I tell people, go sweat like a horse. Go outside and work out, get a sauna, go in there, just make sure you bring a lot of electrolytes. You got to sweat it out of you. The problem with patients with long COVID is they feel so low energy. They tend to stay inside. They, some of my worst long COVID patients never sweat. Never sweat. And I tell them, listen, you have to. They say, well, I feel, and in fact, a sign you have long COVID is you feel bad in a sauna. They'll go in a sauna, they'll go, I feel bad, I can't tolerate the heat. I said, that's a sign you have long COVID. Just like when people say, I can't tolerate the nattokinase. I go, that's a sign you're loaded with spike protein. I mean, it makes sense. So
with taking the spike protein, what do you say kind of, people talk about that Herx reaction, which is like push through and keep
push
doing
through it. It's usually the worst at about 3 weeks to maybe 6 weeks. Just push through it. But when you're taking Ultimate Spike Detox, that tells you you're taking an active medicinal product. You're not taking some inert supplement that doesn't work. I mean, that's the whole reason why we did the research on this and produced the product. The other thing that helps, and I'm convinced theoretically this works, is hyperbaric oxygen. Every study has shown positive. And I think what it does is when you go in an oxygen chamber, you had 100% oxygen, 2 to 3 atmospheres of pressure, really crank it up for 90 minutes, and that blood circulates through the lungs. It's not like EBOO, which it's a little trickle of blood outside the body. Now you have the whole blood volume going through the lungs for 90 minutes, zapping the spike protein. You probably are either denaturing it or hyperoxidizing or whatever, and the body can get rid of it.
And so we just a question about
here. Yeah, okay. So there's HBOT and then there's HBOT. Like there's low pressure HBOT, there's low pressure HBOT with supplemental oxygen, without supplemental oxygen. So the devil is indeed in the details. Yeah. So how many atmospheres, how much oxygen?
I recommend, listen, the Israelis did it at 100% oxygen, 2 to 3 atmospheres of pressure. Where you guys are in Florida, you're at 1 atmosphere of pressure, and you're at 21% oxygen right now. So we're talking about cranking it up, 100% oxygen, 2 to 3 atmospheres of pressure. That means a hard shell.
Yes.
Now, some people say, Doc, I can't afford it, this, that, but I can afford a soft shell. Listen, something is better than nothing. But every study so far in hyperbaric in my clinical experience is positive.
Wow. And so that combined with the spike protein detox supplement that you have, over how amount of time?
About a year.
A year.
Yeah, it's going to take a year.
Long time.
You've had this in your body for years, May. It's going to take at least a year for you to substantially pull out of it. And, thank God you don't have blood clots in your brain or some irreversible damage to your body. I mean, some people have just been wrecked. I've had people with disabling strokes. You can pull out of it, but you do have to. But everything else is everything else is window dressing. I've said people say, well, I have to go for NAD infusions or glutathione. I said, listen, you can do all that stuff. It doesn't do beans for helping you get rid of the spike protein. Bruce Patterson said, well, take Myra-Viroc and then try to inhibit its metabolism with Prevacid. I said, it's not going to work. It doesn't work because you can't stimulate your immune system enough to get rid of spike protein. Obviously, if the body could get rid of it, it would have been long gone. When you get other infections, you don't circulate influenza antigens in your body for 3 years.
No.
Right? Now, I will say this. When there's evidence of immune suppression and patients have Epstein-Barr virus and sufficient related symptoms like lymphadenopathy or shingles that have been expressed, et cetera, besides treating the acute situation, I think there is a role for immune boosters in general, immune boosters. And so, and again, I'm an allopathic drug prescribing doctor. I'm not a natural doctor, but this is what I've found. In this immune booster category, vitamin D for sure. We've done a review on this, at least 10,000 units a day. In the McCullough protocol, we actually had acutely, we used 20,000 a day.
Wow.
So vitamin D for sure. Vitamin C for sure. A little bit of zinc, not too much because we don't want to disrupt copper metabolism for sure. Vitamin C for sure. Probably at least 3,000 milligrams a day. Acutely, people use much higher doses.
Right.
Quercetin, for sure. And now here's some other ones you may not have heard of so much. elderberry, bilberry, oregano, garlic. And of course, most immune boosters have, tons of the water-soluble vitamins. So people say, well, what do you recommend? Wellness Company has natural immunity, which covers some of those. Another one I like is by a company called Healthy Cell, and they have Immune Super Boost. So those two complement each other. The other very interesting thing is the microbiome.
Yeah, I was just about to ask about that.
Yeah, you read our minds.
Because I'm a big believer in that and the gut microbiome and the role in this, because I know mine's been studied by Dr. Sabine Hazen and is terrible. And so I'm wondering how big of a part this has played.
Let me guess, you don't have any bifidobacter?
Almost none.
Yeah. Well, listen, I've been studied too. When I was acutely sick with COVID, I had 0 bifidobacter, and I had a hard time getting through COVID. I had it in 2020. I needed steroids later on. It was rough. My wife we had it at the same time, and my wife had plenty of bifidobacter in her GI tract, and she breezed right through it. So can SARS-CoV-2 knock down bifidobacter? Probably yes. And by the way, bifidobacter is not the only important component of the microbiome. Another very important one's Prevotella. And so what we know there is that if you can boost the good guys, and most of these probiotics are lactobacillus, they're very neutral types of bacteria. They don't do much. If you can actually boost bifidobacter, Prevotella, and others, it potentially could help. I don't think it gets rid of spike protein, but it may reduce this SARS-CoV-2 reservoir in the GI tract. So how do you boost bifidobacter? Well, there's one yogurt that has it, and that's Activia yogurt. It's right in the yogurt.
Right.
Wellness Company.
Too.
Yeah, Wellness Company probably has the strongest probiotic, and believe it or not, it's marketed as a longevity product. It's called Longevity. It comes in a green bottle, and that has 4 different strains of bifidobacter. So definitely that's on base. You'd want to eat fermented foods like kimchi, sauerkraut, pickled carrots and pickles, etc. Pickled foods. So the microbiome's a strategy. Does it solve the problem? No. Patients still need the spike detox. And I think that's the big mistake. I've seen people say, well, I'm going to, quote, fix the microbiome. Well, A, it doesn't stay fixed because people's diets always change. Invariably, someone's going to eat a donut and screw up their microbiome. And on top of that, we have to fundamentally get the spike protein down. So the way to do that is that's the reason why we created Spike Detox. We did not patent it intentionally, so people can use all different brands. Someone told me the other day, they go, well, I'm on Pierre Corey's program. I go, what is it? It was nattokinase, bromelain, curcumin. I said, great. That's exactly what we put in a single capsule, the same thing. So I think a lot of people are arriving at the same conclusion. So, chances are you haven't been on it for a year, or you haven't been on it 2 years, right? You probably arrived at this conclusion pretty late in terms of the spike.
It started March of 23, all my stuff, yeah.
But then we didn't figure this out until like 3-4 months ago.
Yeah, exactly.
Which is interesting because I assume I have no symptoms. I mean, other than I'm 60 years old and my back hurts, but I'm really active. Mm-hmm. And my level's 7,400. So, I mean, I'm wondering how much better I would feel. How much more handsome could I actually become?
Well, we encourage couples to do Spike Detox together. And again, whether you use Wellness Company or you buy them separately, just make sure you're taking good enough doses. So when we started out, like the natto component of it, we did 2,000 twice a day for 3 months. It wasn't enough. Then we went to 4,000 twice a day. And we went longer for a year. It kind of worked somewhat. Now we're up to 8,000 twice a day for 1,600 units of fibrinolytic units of natto as the principal compound for a year. And Jordan Vaughn, who's running the largest blood clot vaccine center in the United States, he's working with Redfield, by the way. That's one of the reasons why Redfield has changed his opinion on this. He's seen all these cases with Jordan. Jordan, out of the box, starts with 16,000 units of natto. Now, the safety limit on natto before we think we're really pushing is 80,000 units.
You're not seeing any big bleeding problems while on it at all?
you'll see some minor bleeding. I've had one case, and I've treated thousands of patients. I've had one case with hospitalized bleeding. It was a GI bleeding. And believe it or not, it was a doctor himself who had alcoholic liver disease and had esophageal varices. Now, he didn't need a transfusion or anything, but the natto contributed to it. Personally, when I've been on 16,000 a day, which I have, I've noticed easy bleeding. If you get a cut, you're going to have easy bleeding. So, each person's different. If you don't have easy bleeding, that tells you something. My patient with blood clots in his brain today, I asked him, he's actually on Xarelto and he's on natto, 16,000 natto. I said, do you have any bruising or bleeding at all? He goes, no, none.
Ooh, that's a bad sign.
Well, that tells you something. And
Yes.
the
And
other
it's clotting.
thing, a quick pearl is, and Tim started out with this, about genetic predisposition. So, for instance, for the man with blood clots, I always check hypercoagulability panels.
Sure.
And about 50% of the time, I find something. If it's vaccine myocarditis, I always check a cardiomyopathy genetic panel. And it's more than 50% of the time, I find a genetic underlying predisposition. And I agree with what Tim said. Most of what's going on, people probably had a predisposition, and that's the reason why they're having symptoms. May, in your case, it's probably a very subtle little polymorphism in a protein that regulates release of histamine from mast cells and basophils. So you're just more prone to this kind of mast cell deactivation. You mentioned Ehlers-Danlos.
Actually, so I went down that rabbit trail. We had Dr. Tyler Pansner on our podcast, who is a PhD in pharmacology and does epigenetic testing. And my stuff came back with 6 out of 8 genetic SNPs for histamine metabolism, mast cell.
Bingo.
And then you look back at my life, and it all adds up. The history of migraines and motion sickness and anxiety and all the IBS, and was happening, and then COVID tipped me over the edge.
It's the great unmasker.
Yeah.
I mean,
listen, you brought up, and there's an important point, because it happened to me too. Because when you get the spike protein, it's an unnatural protein. There's about 32 different homologies with other antigens that can cause a problem. So, for instance, and there was a very good paper on this, I think her name is Astro Naganti from Florida. So, for instance, you can become ANA positive and start to get various autoimmune syndromes like Sjogren's syndrome, mixed connective tissue disease, what have you. I saw a patient like that today. You can get COVID or the vaccine, you can become gluten intolerant with full antibody panel. That happened to me. I can no longer tolerate a single crumb of gluten. And I developed dermatitis herpetiformis from this, which is a terrible, I wouldn't wish that rash on anybody.
No.
You can, the autoimmune nature of this very abnormal spike protein cannot be underestimated. And that's the reason why the antibody test is so important. And I think people should go on a detox. I mean, Tim, I've seen people like you at 7,000, they feel fine, and then they get a little ankle sprain, and boom, it's a 2-foot blood clot in the leg. I've seen that recently, actually. It was been devastating. In fact, the blood clot went from the ankle all the way to the umbilicus, and this poor lady needed an IVC filter. And she said, hey, listen, I didn't take the shots. I just had COVID. I checked her antibodies, and they're up. So she had spike protein. Remember before COVID, an average blood clot that we would see was about a centimeter.
Right. No, I'm convinced that there's a blurring of the lines between the vaccinated and unvaccinated, just because, I've been following Geert Van Bosch since the beginning of the pandemic, and, people are getting more and more and more infections because the hyper-vaccinated are pushing the mutations, and then I think there's clearly shedding. I think there's great evidence for that. So now we're kind of, and then we're back to travel and normal life. So we just have this milieu of vaccines, vaccine shedding, people with recurrent infections, and it's just, we're just kind of bathing in this stuff.
Well, remember I told you about that glycoprotein 120? I think we've all been immunosuppressed. And what happened to me is I got the infection early in 2020, and I started to go on TV. I was on Fox News. I was a frequent contributor. Do you know, I think during 2020 and 2021, I think I had a viral upper respiratory infection every month.
Wow.
I literally could not get well. I was sick. I think when I went on your show, I was sick. I was.
You were.
Yeah, I was continuously sick. The key thing, and May and Tim, both of you should do this. You should do a nasal spray and gargle twice a day.
Yep.
Because a virus is landing in your nose. It's replicating. After 5 or 7 days, it drains back to the throat. Then you get a sore throat. By the time you have a sore throat, you've had the virus for 7-10 days. You've got to spray something up there every day, sniff it back, spit it out, blow it out, and then gargle. Very important. Do it twice a day preventively. And there's been prospective, double-blind, randomized, placebo-controlled trials. That has a 70% plus reduction. Probably you do it perfectly, it's nearly 100%. I've had people on my show that have gone 5-10 years. One guy, 20 years, never had a cold because of this. I'm now on about 2 years myself. It's been so wonderful. And on top of that, because...
Can you tell what product you recommend?
Well, believe it or not, everything works. We've studied this. Everything from just salt water works. Salt water with a couple drops of iodine works. There's super duper products. Wellness Company probably has the best now. It's called Immune Defense, which it's xylitol and erythritol and has like every single wonderful product you want in it. Clear, who actually makes the product for us, they have a bunch of xylitol-based products. And I like xylitol Clear and Immune Defense, and I like the Dental Rinse Spray because it's very good for the oral microbiome. It's like the best.
Yeah, dentists like it too.
What's that?
Dentists like
the dentist like it was ADA recommended, and what it does is it short circuits the replication of strep mutans, which is a chief bad guy in the mouth for gum disease and cavities and stuff. And ever since I started doing this, I go in for my dental exams, and I'm so confident. They say, Dr. McCullough, what are you doing? I said, I'm doing twice daily. And so I gargle for 30 seconds, and I hold it in my mouth for about 3 minutes. I get dressed or what have you, and then spit it out. You get the best dental exams, but you got to do it twice a day. And the reason why it's important, because of all this shedding. Remember, it's shedding not only just of spike protein, but probably the virus. And so, May, you've probably had this a zillion times circulating in your body, and until you set the nasopharyngeal microbiome and the GI microbiome and get rid of spike protein with this, then you're not going to get better. And so once, like I had a patient today who, I've seen these patients first. She goes, Doc, I'm finally better. I'm so glad to hear this. But, she's a law student. She hasn't been able to return to school now for a couple years. She's finally back.
I empathize.
So can you tell?
I was going to ask what the vitamin D level.
One second. Can you put May's heart at rest? She is scared. Well, I'm not going to. The next show we do, I'll probably swear, but I won't. Not to Peter. I have too much respect for her. She is scared, microbiome-less, let's put it that way, of spiking her histamine with nattokinase.
Yeah,
and I was like,
because I've
get
heard
rid of
a
the
lot of
frickin'
negative
protein
effects
and
of people trying your product, especially that have the mast cell issue, and not tolerating it because of histamine release. And I'm not sure what feedback you get.
Just start low. If you're really worried, take like 1 capsule twice a day on an empty stomach, and then kind of work your up to 2 capsules twice a day on an empty stomach, then ultimately to 4 capsules twice a day. So I get up in the middle of the night to pee, and that's when I take it. Make sure I have an empty stomach. Don't take it with food. It's completely worthless. Now, other things do trigger the system. So for instance, some people take B complex and has a little too much niacin or niacinamide in it. That'll make you flush and not feel good, what have you. But you do have to get rid of the spike protein. And I can't tell you how many people, I've had people actually get stem cells. They go to Mexico and they get stem cell treatments. They get EBU. They get all this stuff. They come in with all these reports. I go, where is your spike antibody? It's the only thing in the peer-reviewed literature. I know because I've published it. They go, my doctor never checked that. I go, oh my God, I can't believe you've been searching for years doing all of this stuff. I've had somebody with stem cells get a blood clot in the arm. I had another guy develop myocarditis after stem cells. I mean, these are not benign interventions. The nattokinase bromolan curcumin is predictable. It's predictable. There's some mild blood thinning. There's not much of this. There's not much of this Hersheimer. Yeah, you're probably overthinking the Hersheimer risk there. But just start low. But you have to get rid of it. You just cannot let it sit in your body and you're doing everything around the spike protein. You've got to get rid of the problem.
Right.
Wow. Yeah. This is awesome. I mean, we've done, 400 and some episodes, and this may be the most substantial episode we've ever done because I know, but seriously, like I'm not being hyperbolic. It's just that I think that there is a deluge of medical problems coming. We're barely scratching the surface. I see this every day. Like like we're talking off air. The clinic I worked at yesterday, we saw 112 patients in 12 hours. And, these people come in with these upper respiratory tract infections, and they're like, this is my 4th infection of the year. Why am I getting sick? I just had my RSV, my flu shot, my herpes shot, my this and that shot. And I go, well, maybe that's why, but I don't say that because, they're...
By the way, Tim, when I was getting sick every month, I had I had taken 40 flu shots. I took one every year to be on staff, and after a while I had to be on staff. And I didn't put 2 and 2 together that the flu shot could be making it more likely for me to get the common cold. And in fact, randomized trials have been done, and that's exactly what happens. And a Cleveland Clinic study recently showed the more flu shots you take, the more you get flu. And so it completely backfires. So one of my important determinants of becoming healthy is I stopped taking flu shots. I haven't taken a vaccine now since 2021.
That's like us.
That's
Same.
like us.
We did our own little mini non-randomized trial when we were at urgent care because we started polling patients, polling people that had the flu shot or not had the flu shot, and asked, when they had the flu, did you get a shot or not? And the staff, same thing, because we had to get it. Some of us denied it, and then we would kind of keep track. And really, it seemed like the people that had the flu shot seemed to be the ones coming in or were sicker, and the rest of us finally just said...
But patients would tell you that all the time. They'd say, I never got sick until I started taking this damn shot because I needed it for work. And then they're like, I get sick every year now. And I would just poo-poo it. I'd say, you're a patient. You're obviously dumb because I'm smart because I'm the doctor. When you actually listen to them, they were telling you the truth.
That's like Osler said, listen to the patient. May I have a suggestion, May, because I have a sense that you're somebody, it needs to be proven to you. Send a sample of blood to the Emodia lab. So I'll send you the link for this. This is the German lab. And send a sample of blood there.
I'm unplugged.
And May, they're going to, May, I'll send you the link. Don't worry, I'll send you the link.
Hang on, May is having a technical difficulty. She unplugged herself, so she can't hear you.
I thought maybe she had like a vaccine seizure or something.
Yeah, no.
And it kind of popped out.
Yeah.
It can happen. We just traveled with my mother-in-law, and we went through security, and suddenly her hearing aid was gone.
You wouldn't know how, this part we're obviously going to clean up and edit. As they say, we'll fix it in post. But you wouldn't believe in Sarasota how many hearing aid tips I pull out of people's ears.
Oh my God.
Okay, now I can hear.
Yeah.
Well, my wife went back to security, and we went forever trying to find Mama's hearing aid, and it was long gone. So May,
here we go.
You seem like you're somebody who you really need to have this shown to you as being a doctor. Both of you are doctors. So send a sample of blood to the Emodia lab in Germany. I'm going to send you the link to it. And you can just have, somebody in Tim's clinic draw the blood, and they give you a sample pack. They'll tell you how to do it. Send it there, and you'll see how much vaccine is in your bloodstream and how much spike protein and spike fragments are in your bloodstream right now.
I want to see it.
And I think that will be such an eye opener for you.
So it can differentiate between vaccine spike and
Yes.
COVID spike?
Yes,
and
they
native
can
spike?
see the full length spike, and then they can see the COVID S1 tip spike inside the monocytes. And they'll tell you how much is in the monocytes, how much is just floating around, and you'll find it very useful.
Okay.
That is awesome. So
And then I'm going to try your product, and if I start to have a bowel freak out, which from my MCAS
No, you're
or
not
something
going to
else,
freak out. Just,
I will
take
call-
it on
I'll
an
come
empty.
to you in Dallas.
Well, May, listen, if you take Ultimate Spike Detox with food, that's the mistake people make.
Right.
Is it starts digesting the food, then you will have a GI crisis. So it has to be on an empty stomach. So, I'm a man a little older than Tim who's blessed with a prostate problem. So I have to get up at night to pee. And so when I get up at night to pee, my stomach's empty. That's when I take it. But if I took it with any food in my stomach, I'd be running to the toilet. Okay. So start out with 1 twice a day, completely empty stomach. So that means at least 3 hours after eating and at least 30 minutes before eating, okay? To make sure your stomach's empty. It gets rapidly absorbed. Let your body get used to it and then start building it up. I've been on this. I first published this method before the wellness company had a product. Okay, so the product occurred after the research was done, but we were just using over-the-counter products and it wasn't until we learned that we have to get rid of the spike protein. There's nothing else that gets rid of it so far. So
hey, speaking of that though, I was just reading this publication. There's someone local, literally in the Sarasota area, who's called the mast cell specialist. He's in research. It's Theo Herides is the name. I don't know if you've heard of him, but he's done some research using some flavonoids and looks like a compound called uriodictol with oleorupin from olive leaves is showing to maybe to cleave spike protein now. Is that
you can give it a try. I'll tell you, everybody has their own little way. I don't think antihistamines work that well. So people take Benadryl or take other. I don't think they work that well. So I've found that the leukotriene pathway does play a role. I found this during COVID. So Singulair, 10 milligrams a day. For me, that's a standard for patients with mast cell. And then the go-to drug that seems to really kind of the strongest mast cell and basophil, don't forget, it's not just the mast cells, but it's also the basophils, circulatory basophils, is cromolyn. Mm-hmm. So I order liquid cromolyn, maybe just a teaspoon here and there. And you'll get through it. As the spike goes down.
Is fairly well tolerated too.
Right.
I mean,
that's a... No, I was curious. This product he's got is called, I think, Viral Protect or Viral Protect, and it's supposed to cleave spike protein in some way. I'm scanning the literature all the time. There's just the company with the augmented NAC, they claim it denatures spike and they claim that spike comes out in the urine, but here we are years later, they don't have a single abstract or preprint demonstrating it. Now, I heard that from Dr. Tina Pierce, but I haven't seen anything.
Yeah, I mean, that's a little bit suspicious. And also they can't explain how their product is augmented. They say that the nuclear magnetic resonance of it's changed. So what we did at the wellness companies, we just made a really high quality NAC product. We added other detoxifiants to it that we have some, proven hepatic effects that are used for other kind of general detox. And we said, listen, here's an NAC. At the wellness company, we typically don't make singular products. We make lots of combination products in order to keep the costs down and give you the most you can possibly get in a capsule. And listen, that's perfectly fine to do that. But, when someone presents to you something that's kind of nebulous, well, it gets rid of spike protein. Well, how does it get rid of it? We don't know. It's just, no. Listen, spike protein is pretty easy to measure in the lab. You can measure it. When Tanakawa used nattokinase, it literally dissolved the spike protein in intact cells and cell lysate models because the nattokinase goes inside and outside of cells. Makes sense. Giving a vitamin or what have you is not going to do anything. The human body it's stuck with this. It's in many ways, the human body is stuck with spike protein just the way Lyme patients are stuck with Borrelia burgdorferi. We don't get rid of it that well. And by the way, the human body doesn't get rid of syphilis very well. That's the reason why you get syphilis decades later. You get post-syphilitic because we can't get rid of those antigens.
Is there any research on the HBOT, on like amount of sessions, timing, anything like that?
Yeah, the Swedish have a protocol that they've published as a concept protocol where they go 6 sessions, which I think is pretty short. The Israelis, where it's been published, they did 45 sessions.
Wow.
So we're talking 2-3 times a week for weeks.
Right.
So I said, listen, we're in America, it's expensive, split the difference. I'd say go 20.
All right.
Okay.
Good
No,
to know.
this, like I said, again, not to be hyperbolic, this is great because this is very, very practical information that our listeners and us, like as, you know, I'm still practicing medicine, that we can take to the public and say, look, you know, it may not just be that your high blood pressure got worse because you're 2 or 3 or 5 years older since the pandemic. It may actually be because of this spikeopathy. Your anxiety didn't get worse just because you moved across the country like we did. You actually have a spikeopathy. And again, go to LabCorp, get the quantitative antibody test. It's not hard to do. If you're under 1,000, you don't have anything to worry about.
Yeah, under 1,000, Tim, I strongly believe this based on the data. Under 1,000 rules out the spike protein. So I'll see patients say, listen, I got atrial fibrillation during the pandemic. I think it was spike protein related. I said, no, it's not. Your spike levels are 90. It cannot be due to the spike protein. You just have AFib because, you know, whatever the factors are. So it's so good to get the rule out. You get plenty of people below 1,000. You get tons of people below 1,000. They're essentially, you know, that's just back to normal medicine.
Yeah. No,
Wonderful.
This has been fantastic. Any parting words for us? Again, every time we talk to you, it's like we can talk to you for
I just want to say
hours.
the reason why BS-free, this is such an important podcast, there are no medicine grand rounds on this. You know,
No.
Pri-Med, which is a big primary care series, there's no Pri-Med on this. Patients go to Mayo Clinic and they'll say, listen, I think I got a spike protein problem. The Mayo Clinic will not even consider the spike protein. They won't measure even antibodies to the spike protein.
No. I mean, I'm in Facebook forums. I've always learned so much from patients in the past, you know, who are going through conditions that we got little training on. And now I'm stuck in these groups and have learned a ton. But there are a few COVID clinics around the country. I mean, you've probably heard of some of the experts running some of these things that it's a smattering of supplements. Like you said, there's usually a nattokinase and some curcumin and some other anti-inflammatories, but really people, it's just a crapshoot of what they're trying, you know.
Well, if they're using nattokinase and bromelain and curcumin, at least they're evidence-based. That's the reason why it's been copyrighted McCullough protocol base spike protein detoxification. It's a base, and on top of that, if things can help. So when the Swiss did a study with nicotine, I said, it's kind of interesting. I'll give it a shot. I'm convinced it actually does have a favorable effect. I mean, I'm convinced. When the Israelis did the hyperbaric, I tried it myself. So when I see people improve myself on McCullough protocol-based spike protein detoxification, I know we got it. Now, I've seen so many patients do so many other things, but they've never taken any nattokinase or bromelain.
No.
It's like, oh my gosh, like really nothing? No, I'm not better. Well, no wonder you're not better. Your spike protein antibodies are high, and you've never done anything to get rid of it. You've just been going around the problem.
And do you have like a rough idea, like how would you know a percentage of people that use your protocol and get better versus have to do longer than 9 to 12 months?
I'd say probably 80 to 90% get better. We look for a 20% reduction in antibodies at 6 to 9 months. Remember, the antibodies lag considerably, the antigen. I'd say 80 to 90% get better. I have a few notable patients that did not get better. Now, they were, unmeasurably high, over 25,000. We don't know how high they were, but they would not budge. They would not budge. And we went on and on and on. We actually used Neo7 Bioscience, John Cantizaro, and we used peptide therapy. There are some targeted peptides that potentially can zap the spike protein. And we did that in research. And ultimately, patients got better. So I don't have anybody who hasn't gotten better. I was notified, I've had some disturbing cases of death of syndromes. I think once the syndromes take off, I don't think it's recoverable. I just had a wonderful man die of he was genetically loaded for mitochondrial types of neuromuscular abnormalities. He had 4 or 5 genetic mutations. He developed a syndrome that looked like ALS after the vaccine, and his voice and everything. And somebody just told me 2 days ago, by the way, he died. It took like a year and a half, and he died.
Well, and we're finding that this spike protein is unleashing all kinds of autoimmune diseases, cancers, like turbo cancers.
Well, he had very high spike protein. Yeah, he had very high spike protein, and we had him on spike detox. But I haven't found some of these deep neurologic syndromes, like these ALS-like syndromes, are completely resolvable. I've seen Guillain-Barré syndrome resolve, blood clots for sure resolve, myocarditis for sure resolve. But I do worry about some things where there's permanent damage.
Well, we know what we're doing.
Yeah, and if you need a guinea pig to do any experiment on, I'm happy to make a flight into your clinic.
Yeah, our daughter lives in Texas.
Listen, happy to see you. No charges or anything, professional courtesy. But do send a sample to the Emodia lab. I'm going to text you or I'll email the link.
I will.
But you have to. I think you're someone. I think you're still. I can tell by talking to you, you're still hesitant. You're like, is this really the case? You have to see spike in vaccine in your bloodstream, and then you're gonna understand.
I believe it is there. I've been struggling with all this histamine problem that everything I put in my body keeps me either awake all night or in the bathroom, and that's kind of what I'm afraid of. Full disclosure to our audience, so they've heard it already.
And also, too, wellness company longevity, you're probably going to have to give 4 different strains of bifidobacter to really get this back. I haven't found anything else that really, you can't eat enough Activia yogurt. And if you eat too much kimchi and sauerkraut, that's going to put you in the bathroom.
Well, someone with my condition cannot have anything fermented. It's like the worst. So that is the struggle with mast cell. You can't have fermented food.
Well, I think that's the reason why they get wellness company.
More reason for the bifido supplements, yes.
Yeah, now we don't know how much survives the upper GI tract, but my experience is the only product out there. And it's interesting. It was Dr. Drew Pinsky who helped design it. And we thought this was, oriented towards human longevity, but it's probably going to be just great for this restoration of bifidobacter. And we've run it past Sabine Hazen and said, listen, Sabine,
say, she should study that.
I know we've got to get a probiotic. People can only do so much with diet. I've had Sabine on my show. I said, Sabine, listen, I had the same problem. How do I do it? And we're back to Activia yogurt, kimchi, and sauerkraut. It's like, there's got to be a better way, right?
Well, she could put a colonoscope up there and implant it.
Oh, no. Listen, guys, we've been going long. I have to get going.
Yes.
All right. Thanks again,
Peter, for being on the show. We'll let you go.
Always appreciate your time.
We'll be in touch.
Okay, bye-bye.
It's no secret that medicine is a bit, uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more, and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
But we try to keep BS Free MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.